Sound check 1 2. Sound check.
As a Ministry of Health, we do have strategic plans that are guiding this community-based approach. We currently are implementing the second strategic period approach, 2014 to 2019. And this plan, as reiterated, really looks at strengthening community structures, ensuring that systems are effective for implementing community health actions, and that there's also strengthening of data demand and information for use at all levels. We are looking forward at the end of this financial year to begin a new strategic plan again that will look to further enhance these measures when it comes to community health strategy and ensuring that we are able to utilize this great resource in terms of COVID-19. Currently, we are at 60 level of implementation in terms of community health in the country, and we expect to continue beefing up, and this forms part of the UHC agenda with the aim of ensuring that we have an additional community health volunteers onboarded in all the 47 counties. With regards to our COVID-19 situation, we currently have 278 people who have tested positive out of 4,074 samples which were run in the last 24 hours. This now brings our total tally of positive cases in the country to 5,811. An accumulative number of cases conducted so far, 162,478 tests. Out of today's cases, all except 2 are Kenyans, and according to gender, we have 181 of them being male and 97 of them female. The youngest is 1-year-old infant, whereas the oldest is 84. And the cases are distributed as follows in terms of county disaggregation. Nairobi leads with 171 cases, Mombasa has 37, Nakuru 17, Kiambu 12, Busia 10, Uasin-Gishu 9, Kajiado 4, Migori 3, Kericho 2, Machakos 2, Nandi 2, Trans Nzoia 2, Siaya 1, Taita Taveta 1, Kwale 1, Kisumu 1, Makueni, Meru and Vihiga all having 1 case. The cases are distributed in various sub-counties across all these different counties, and I'll give a highlight of some of these. In Nairobi, again, as mentioned in the past, we have Westlands leading with 34 cases, Lang'ata 28, Dagoretti North 17, Makadara 16, Kibra 11, Embakasi East 10, Kasarani 9, Embakasi South 8, Kamkunji 8, Starehe 6, Embakasi West 5, Dagoretti South 5, Embakasi Central 4, Roysambu 4, Mathare 3, Ruaraka 2, Embakasi North 1. In Mombasa, Mvita leads with 14 cases, whereas Nyali has 6, and the least are in Changamwe having 2. In Nakuru, we have Nakuru East having 8, Naivasha 6. In Kiambu, we have Kiambu Town having 5, Kikuyu having 3, we have Thika having 1. In Uasin-Gishu, the 9 cases are from Ainabkoi, 3 from Kapseret, 2 from Keses. In terms of Kajiado, we have Kajiado North having 3, Kajiado East having 1. In Kericho, we have 2 cases from Ainamoi. In Machakos, the cases are from Athi River, 1 from Athi River Town, 1 from Machakos Town. In Nandi, we have 2 cases from Chesume. Trans Nzoia, 2 cases, all of them in Kwanza, whereas in Siaya, we have 1 case in Gem. In Taita Taveta, the case is in Voi, in Kwale, in Matuga, Kisumu, in Kisumu Central, and in Makueni, the case is in Kilome. In Meru, we have 1 case in Igembe South, and in Vihiga, we have the case in Vihiga Town. Today, we are happy to report that we've discharged 31 patients from various hospitals, bringing to total 1,936, the total number who've recovered so far, and we continue to salute our healthcare workers for this commendable work. Unfortunately, we've lost another 4 patients to the disease, bringing our total fatalities to 141, and our sincere and heartfelt condolences go to the family and friends of the departed. On a related matter, we have noted with a lot of concern, incidences of COVID-19 infections have arisen, and particularly due to cross-infection in healthcare facilities. And this is a matter that the ministry has taken seriously, and we would want to appeal to all hospitals, public and private, to be extremely careful to ensure that they put in place measures that reduce the possibility of cross-infection. The ministry reminds each and every partner that we shall continue to work together to ensure that regulations are adhered to when it comes to preventing cross-infection at the hospital level. Breastfeeding has not been identified as a source of infection when it comes to COVID-19 from mother to child. However, what we are realizing is that some of these infants, when we do go to contact tracing and test the mother or the household, there are some positives that we are getting. So it's all back to those containment measures within our households. It's all back to ensuring that we are sanitizing our surfaces in the houses. For those who can stay at home and can work from home, that can be, undertaken. And for those who, live out of their households and go to their workplace, they're able to ensure that they are masked and that they're actually sanitizing. So we'll continue watching this trend. So far, ideally what we are noticing is primarily transmission from the household and the contacts of the infants.
Let me reiterate here that Shalom Hospital is not closed. Shalom is still operational. It still has 125 patients in there. In fact, there is one we are following up closely. And we are doing testing. The staff that are there just to the extent of the disease within the facility. Treatment is ongoing, but they are not taking in any other inpatients or outpatients until they establish what is happening. So it has not been converted to a quarantine facility, as you may have suggested. But for now, those who are in there are quarantined, just as the word quarantine means, until we establish that there are no infection. Healthcare workers who are there, we're trying to ensure that they are rotated because they cannot continue working. We are working on a modality where fresh group of staff can go in with the proper fitting of PPE, and we have made sure that the adequate PPE has been prevailed at the hospital. So they will be rotated, and those who are in will be moved into safe quarantine, either at home based on the assessment of the home background that is being done currently, or in a facility, and we are in discussion with the hospital management to see how best we are going to quarantine the healthcare workers in that facility. So it will not happen to any other hospital that you get a case and you close down the hospital. No, it will be on a case-by-case basis based on the level of the infection that is going to be identified. Moving forward then, it is important for the general public to note that not every other hospital is a COVID facility. And the government in the coming week, through the Kenya Medical Practitioners and Justice Council, is going to be gazetting the list of facilities that have been inspected and certified as fit for COVID management. So the public should be aware of this in the coming one day or two, the gazetted facilities for COVID-19 management. In the meantime, even though you are not a COVID-19 management facility, it's a requirement that every other health facility is equipped with adequate PPE for that unforeseen event that a COVID suspect may walk into your facility. You must have adequate PPE to be able to manage that suspect. And in the course of treatment also, you may encounter one who turns positive. Remember, we are still dealing with a huge percentage of asymptomatic individuals. So anyone may come in with malaria, but the chance of still turning positive is still high. So your hospitals must be prepared at all times. And you must assume that every other patient that you are handling is potentially COVID positive. And I think the CS has stated here again and again that looking around you, the person next to you could actually be positive. It's just asymptomatic. So healthcare facilities, whichever it is, a small clinic, the pharmacies, our IPC guidelines must be adhered to very strictly, and PPE must be availed to all. And even those who are opening small business premises, have a small kit of PPE around you, because anything may happen around you, and you may need to use that PPE. So healthcare facilities especially are required therefore to ensure they have an adequate stock of PPEs for those eventualities. On the issue of testing, yes, the ministry is in the process of realigning its testing strategy to manage so that the testing is aligned to the measures that the government is taking. The current measures, of course, the government is taking, you are aware of the widespread transmission within the community. So the measures the government is geared to today is try and contain the infection as we are, and still mitigate those who may get mitigate against the infection, so that we are able to isolate those who turn positive and manage them appropriately.